The first question, what exactly is a facelift? Now this can be a very confusing term, and first of all, nobody wants a facelift. The word facelift scares people, and it's really, patients come in and they're so confused about what a facelift is because you look in the newspaper, you turn on TV, you hear about quick lifts, Mac lifts, S lifts, lifestyle lifts, mini lifts, maxi lifts, partial facelifts, neck lifts, mid facelifts. What is a facelift? A facelift, by definition, is a procedure that's about 100 years old, and it is also called a rhytidectomy. A classic facelift has incisions in the sideburn, in front of the ear, behind the ear, and back into the hairline, and all these incisions are hidden. Also, a classic facelift involves a platysmoplasty, which is a small incision under the chin where we put the neck muscles together. So that's what a facelift is. Next question is, what does a facelift do? Again, it's very confusing because some people come in and they say, well, am I getting a full facelift? Is that opposed to half of a facelift? Again, this confusing nomenclature. A facelift basically is a procedure to address the jowls and the neck skin, and it's really from here to here. So a facelift really doesn't do anything from here on up and doesn't do anything below here. So it is about from this area to this area. And the main job of a facelift is to address jowling or tighten the jowls and to address the loose neck skin that we get. So a facelift does this. Now patients come in all the time and they say, hey, I look in the mirror, doc, can you just do this? And one thing you have to understand is there's no procedure that does that. And actually you'd look pretty funny if you did that. So a facelift, to review this, is a procedure with incisions in front of and behind the ear and under the chin. It addresses the jowls and neck skin from here to here. Now, it's not uncommon with a facelift that a patient may have a brow lift, eyelid surgery, facial implants, or laser resurfacing. But a facelift by itself, the rhytidectomy, the classic procedure, is what we just described. Next question is, what won't the facelift do? And this is really important because sometimes patients will come in and they'll say, I want a facelift, and they'll say, I'm really anxious to get rid of the wrinkles around my mouth or the crow's feet or the furrows in my forehead. Remember, a facelift classically is a procedure that addresses loose skin and jowls from here to here. Now, a facelift does very little or nothing in this area, the central oval of the face. And if you try and make a facelift do something in that area, it looks very unnatural. Everybody's seen a bad facelift where the patient's mouth is about twice as wide. So again, the facelift does very little in this area. It is primarily for the jowls in the neck. And we can do things along with the facelift to approach this area. We can do laser resurfacing, eyelid surgery, facial implants, and brow lifts, but the facelift does very little in the central part of the face. Now, this next question is really important, and I get this a lot. People say, well, I was watching TV and they advertised this facelift. I see the advertisement every hour, and it says it's a medical breakthrough and it's revolutionary and you can drive home and you don't need bandages and you only miss 3 days from work. Listen, if something sounds too good to be true, it is. The consumer has to be very careful. There's a huge trend out right now for to sell or promote facelifts that are very simple, very easy, and you got to remember, you get what you pay for, not in money, not in dollars, but in recovery. I can do a facelift on anybody and do a very short lift with a very short scar and have a small recovery, but you know what? It's gonna, in 18 months, their aging is going to come back. So you have to understand the difference. It's apples and oranges, all right? When you start changing the classic facelift, and remember the classic facelift is incisions in front of the ear, behind the ear, into the hairline, and the platysmoplasty. When you start eliminating any part of this procedure, you're going to pay for this in loss of longevity and not being able to be as tight as it can for as long as it can. So when you see these real small lifts, and there's many of them out there, what happens is the doctors, they don't do the platysmoplasty. Don't let anybody tell you you don't need to do that procedure, because we've been doing this for a century. That's an extremely important part of facelift surgery, and when I show the movies in the later part of this video, you'll see why. So if you're not getting a platysmoplasty, you're missing out on the neck to be as tight as it can for as long as it can. The second big thing that people leave out is this incision behind the ear. And this is about maybe a 4-inch incision, and it's hidden in the hairline. Yet many surgeons say, well, you don't need that incision, and so they eliminate that incision. Well, if you eliminate the platysmoplasty, you eliminate that posterior incision, yeah, you're going to be able to do a quicker facelift with less recovery, and people will get back to work quicker. But their result is going to suffer. They are not going to be as tight as they could be and as natural looking as they could be. And believe me, every week somebody walks into my office that has had one of these miracle lifts, and they feel really taken advantage of because their skin is back, or really was never tightened enough in the first place. And before you consider having any of these corporate type lifts, just Google the name of that company and Google complaints for that type of facelift. It doesn't bother me that anybody's doing a short scar facelift with a small incision, small recovery, if they promote it as that. But believe me, if that procedure was really adequate, no surgeon would ever do a bigger procedure. We do bigger procedures for a reason. So when do I use these little small short scar facelifts? Maybe on a patient that's 38. I never do them on a patient that's over 40 because those patients need this back incision. This is really important to pull the neck skin. You can't pull the neck skin with a front incision. And you'll have people argue and say they can, but you look at 100 of their pictures before and after, and look at 100 of my before and after pictures, or other surgeons that do a comprehensive facelift, you'll see a big difference. And again, I don't care what somebody does as long as they give full disclosure to the patient. I see many elderly patients that were taken advantage of by some of these companies. They were sold a bill of goods. They had this small little lift, and in reality they needed a big lift. And what happens? Well, first of all, it doesn't address their aging. So they've had a facelift. They've spent as much money as would cost for a normal lift in my office. And a week after their facelift, or a month after their facelift, they still have extra skin here because they didn't have a platysmoplasty. They didn't have that posterior incision. I'm not talking bad about anybody or any lift, but again, you get what you pay for, not in money, but in recovery. So if you're going to have a facelift, you got to find out, what does that surgeon consider a facelift? Because a classic facelift, and I know you're getting sick of hearing this, incisions in front of and behind the ear that are hidden, and a platysmoplasty. An additional situation when talking about these small lifts, there's a lot of reasons why some doctors do these lifts, and that's because some doctors don't have the training or the ability to put a patient to sleep, or they don't have I'm sitting in my AAAHC fully accredited surgery center. Accreditation is very difficult and very expensive to maintain. However, we can bring somebody in here and sedate them or put them to sleep. So some doctors don't have the training or the ability to do that. Therefore, they have to do everything awake. And other doctors may not have experience to do a bigger lift. And listen, we all had to start out with small lifts because that's how we learn. And there's nothing wrong with a small lift if you have small aging. So again, you have to ask, why is somebody doing a facelift on a patient that's awake? Because anesthesia, if done correctly, it is very safe. I think people are in more danger driving to my office, being out on the road in a traffic accident, than they are having an anesthetic complication. And so it's not fair to downplay anesthesia. All our patients have a history and physical and the appropriate lab work. And why does a doctor do stuff awake? Okay, well, maybe he or she doesn't have the training for anesthesia, doesn't have the facility for anesthesia. And I'm not saying that there's anything wrong with this type of surgery, but bigger lifts really require IV sedation or anesthesia because you're doing more surgery and you're getting more result and you have more recovery.